Good evening, everybody. I suppose the first thing that I just wanted to do was introduce myself. My name is David and I work as the health and wellness professional for a company called DeCare. If you haven't heard of DeCare before, we are owned by one of the largest healthcare insurers in America, Anthem. And we do three things within Ireland. We do dental benefits for companies, so we work close to 500 organisations. We do wellness programmes across Ireland in several different companies, and we also train in the healthcare sector in education and training programmes as well. And for today, I hope everybody, regardless of your size and what kind of area of business you're coming from, where are we on the wellness journey? And that's different for every single company and everybody here today. So I hope there is something that you can take. There's very practical information that you can implement straight away from this presentation, and everybody can take away a little bit from it. I'm going to go through a little bit about about the science and a little bit about the theory of the way we look at health, because it's fundamental when we're doing a strategy or a policy within the workplace. I'm going to talk about some initiatives that you can implement straight away, and then at the end, that post-it that Sven has mentioned, we're going to do just a small exercise and get you up about behavioural change and how that adapts and how that fits into the workplace. So I suppose the first thing is that's a very, very strong image there, that life course approach image. And the workplaces, they directly influence physical, mental, economic and social well-being of workers. The WHO, the World Health Organization, has issued that the workplace is the optimum place to promote health. You can see there from the image, we entered the workforce from our first part-time job from about the age of 15 onwards, and by 65 is not by no means a retirement age, but the 65 plus market, you can see that whole yellow, we spend a huge amount of time in the workplace across our life course. So it is really an optimum place to promote health, but it's also one of those places with managers, team leaders, where we develop bad habits, physical activity, diet. It's one of those areas we can really focus on and work on within our lifestyles. Just to look at a little bit about when we think about wellness and when we think about health in particularly, you hear kind of two words, mortality and morbidity. So what's actually, we're all running businesses, or we're busy in our roles, but you cannot but look at social media, the Irish Times, and see kind of what's out there and what's happening. Well, the Central Statistics Office statistics, cardiovascular disease and CVD, cardiovascular disease, stroke, is the #1 killer in Ireland, closely followed by cancers and respiratory disease. And this was taken back in 2016, and only in 2018 has cancer actually overtaken again as the #1 killer within Ireland. So cardiovascular disease actually bumps in at #2. And it's a lot of asymptomatic, it doesn't produce a lot of symptoms, so that's why blood pressure, we have blood pressure today for anyone who didn't get it done. I'd advise them, it's a nice thing to have done afterwards, starting off a new year, because it's one of those things that we don't have a symptom for, it can just happen. To look at years ago, we had things, communicable diseases, which were diseases that we could catch, like TB, and these were the things that were causing mortality within Ireland and globally. But again, there's been a shift in the last kind of 30 years to non-communicable diseases, things like cancers, CVD, lung disease, and diabetes type 2. So these are the things that are causing the biggest mortality rates and the biggest cause of morbidity in Ireland as well. These link to, it might surprise you that these link to 60% of deaths globally. And believe it or not, they're actually combined down to 4 modifiable risk factors. So if we actually try and focus our lifestyles on diet, in physical activity, smoking and alcohol intake, those 4 modifiable risk factors have a dramatic impact on developing the cancers, cardiovascular disease and these non-communicable diseases. Yes, there is a genetic factor and an epigenetic factor with certain types of cancers, breast cancer, colon cancer, all those different things, but the majority of 60% of deaths globally of those statistics go back to 4 modifiable risk factors. So they're huge areas just for the workplace to take away from today. They're not the be all and end all, and we're going to look at the causes of this, the causes that cause people to go for physical activity, poor diet. But these are 4 modifiable risk factors that we can really work on to empower people to have healthier lifestyles within the workplace. I have a question for you today, because I'm very intrigued to know the answer, because there's a purpose to me asking this question, particularly when you're going to look at your workplace, your employers. What is health and what does health mean for you? So health means different things for different people. And believe it or not, it can be as simple or as complex as we look at it. But it's very important to get this fundamental question right before we plan strategies and policies around health and well-being within the workplace. So if I could ask maybe just, I won't ask everybody in the room because I'm conscious that you want to go home on a Wednesday night, but if I could ask maybe a few people, when they think of health, just a word that comes to their mind?
Physical fitness for me.
Physical fitness, yeah, absolutely, yeah. Yeah, maybe yourself?
Enjoyment.
Enjoyment, yeah.
Mental health.
Mental health, absolutely, yeah.
Being able to do things that people 20 years younger than me can.
Can, yeah. That's a good one. And maybe go to maybe someone at this side of the room if they want to, just what they think of health when it comes to their mind, a word.
Mental health.
Mental health, yeah. Sorry.
Stress-free.
Stress-free, yeah, absolutely. Maybe someone here.
Sleep.
Sleep, absolutely, yeah. And a huge one that's emerging, sleep, and a lot of studies on sleep and health, yeah.
Mobility as well.
Mobility, yeah, absolutely. Being able to do your everyday life and being able to move it about, and maybe yourself.
Yeah, feeling fit would be.
Feeling fit, yeah, exactly. The point of that is you can see every single person that's in the room tonight, health means different things to different people. So when we look at health and well-being in the workplace, we really need to know and ask the people, know your culture, know the people that are working in your organisation and know what health means to them. So if you're ever doing a Google form or a SurveyMonkey or whatever it may be, ask the question, what does health mean for you? And you'd be surprised what you get back in those answers to actually implement into a programme, that you're not leaving something out, because health is quite broad and you want to make a strategy that works for your own culture. The WHO, just to go into what health actually means, they back in 1946, believe it or not, they said it was a complete state of physical, mental and social well-being and not merely the absence of disease. In 1946, that's been praised and it's also been highly criticised. They were way ahead of its time to recognise mental health in 1946, but it's taken us probably up to this day and age to really address, and it's still only happening, mental health, particularly within the workplace, but particularly within our health system. This has been criticised for a lot of reasons. Can anybody point out maybe why we would criticise that definition of health?
Sounds impossible.
Sounds, yeah. It's very unreachable, and it's a really good answer. The other reason behind this definition of health is there is no complete state of physical health. By that definition, if someone is in a wheelchair, we're calling them unhealthy, and that's simply untrue and unethical. It's also been criticised because there's no complete state of, if someone has diabetes type 2 and they have a controlled blood sugar, they're still healthy, they have a condition, but they're not. By this, we kind of class them that it's ill health. So the World Health Organization has moved from a definition of stigmatizing people to actually more of a concept. And particularly for the workplace, this is a definition that's used globally, that health is created and lived by the people within the settings of their everyday life, where they learn, work, play and love. Health is created by caring for oneself and others, by being able to take decisions and have control over one's life and circumstances, and by ensuring that the society one lives creates conditions that allow the attainment of health by all its members. It's a lot broader than merely the absence of disease, which is what the other one had said. The two concepts, and again, these are just key two concepts to kind of think about when you're looking at workplace wellness. The two concepts of health, very much so our health system, and particularly our public health system, and a lot of perceptions of people, including my own perception from working in the dental environment, was when you see someone, they come to you when they actually have the end problem, when they need treatment. Where's the prevention that you can jump back on that? And our health system is a little bit like that. We tend to, when we're sick, go to the GP, go to the hospital, get our prescription, get our antibiotic, be cured, and then we flow out again. We tend to look at health in our health system, and the majority of our budget, over 60% of our budget in our health system, goes towards a biomedical view of health, treating illness and not jumping back to look at prevention. This is what's called can I have a show of hands if anyone's ever seen this diagram in the room? Yeah, you've seen the diagram. Has anyone else? It's okay if you haven't. This is a much more broader view of looking at health. It's called the Socio-Ecological model to health. Don't let the name throw you off, but I do want to explain this to you a little bit and a little bit more in depth. Our Healthy Ireland policy, the WHO, the World Health Organization, has asked every government to implement this. And I've seen it in I get to visit an awful lot of workplaces and plan health and wellbeing programs over the last 6 and 7 years, traveling to small, medium companies, to the large corporate companies. And a lot of people are including this in their health and wellbeing strategy. And what it does in manager training, in team leader training, it helps you view a person as a whole and helps you view them totally different to the absence of disease. It makes you look at the whole person holistically. Just to explain it a little bit to you, because it maybe can look a little bit confusing. In the middle, we have ourselves. We have the person's age, whether they're male, female, and any genetic factors that they may have. On the purple ring, which is individual lifestyle factors, it's looking at a person if they smoke, alcohol intake, their level of physical activity. The outer circle, which is community and social networks, is a person living alone, are they married, what's their interactions, their networks. We now know that dramatically impacts on our health and our mental health. Mental health is enwrapped in every single pillar that I'm talking about here today. We know that where we get our food sources, our level of education, but this is the one we're very much concerned about. We know that living and working conditions, the working environment is a determinant to our health. A determinant to our health is something that brings along a positive or negative experience, and it's bound in science that the workplace, from several different studies that I can mention to you, dramatically has an impact on our health for the positive or the negative. The outer circle then addresses things like government and policy and what's in place for people that impact on their health, whether it's transportation, getting to work, whether it's food policy, something for the elderly. It's a very layered, holistic approach to health. Would you, from looking at that, I know you'd seen that model before, would you agree with that? Would that kind of change your perspective a little bit to health, that we're kind of thinking of it not just as the mere absence of just disease, that we're actually thinking of it as a very layered, where we live, where we grow, where we work, where we love, those kind of four things really dramatically impact on our health as a whole. Does that make sense to you? Yeah. Just to give you an example of this, and again, I'm going to talk with cardiovascular disease. It was the #1 killer globally and in Ireland. We have cardiovascular disease. Just as an example, we'll say what causes cardiovascular disease. You might say physical activity, smoking, or you might say some of those risk factors. Those things absolutely, in physical activity, fat, sugar intake, weight, alcohol, smoking causes cardiovascular disease. But if we jump back, there's also things that I just mentioned from that diagram. Our age is a huge factor. Our level of education throughout our life course is a huge factor, because if we have proper education, we can make empowered, healthy choices. Our level of health literacy, and of course our income, our jobs, our education, where we're growing up, who we are, has dramatic impacts on if we will develop disease or not, believe it or not. I know there is a genetic factor to that as well. To jump to mental health in the workplace, just to give you a bit of an ideology of mental health, we look at mental health. This is the dual continuum of mental health. And again, it's in a lot of workplace strategies. And I know you have it printed there in front of you to take away. If you want to look that up, it's a very, very simple model that can be used within the workplace. It looks at mental health as mental health is here, mental illness is here. So if you've done mental health first aid training or whatever it may be, everybody has a level of mental health. Everybody, if you have a mental illness, has mental health. Mental health is, when we're in a workplace, we want to create a supportive environment and we want to tackle everybody's mental health. So mental health on this diagram is represented on the left-hand side, mental health without mental illness. But likewise, if we have an employee that has a diagnosed mental illness, we can still target them with mindfulness, with resilience, with emotional intelligence, with whatever program we may be running. But they're just categorized on this on the right hand side of the model. So when we train managers and team leaders and line managers, HR professionals within the workplace, we want to kind of show them that mental health is the real umbrella term, and everybody's mental health is important regardless if they have a diagnosable mental illness or not. This is it's highly referenced, it's a dual continuum of mental health. It's used an awful lot in health and wellbeing strategies, particularly in workplace, occupational health, mental health strategies. And again, if anybody has any questions on that at the end, I'll be happy to give you the reference and everything to go towards that. Michie Williams, this was one of the biggest, in Ireland we're not great with statistics and evaluating things and kind of gathering evidence, but in 2003 this is probably one of the biggest, done in the UK, one of the biggest kind of systematic reviews of psychosocial work factors. Things like long hours, work overload, pressure, lack of control, lack of participation, unclear management and work role was shown to cause mental ill health. And it manifested in things such as absenteeism, reduction in productivity, error rates, loss of motivation, poor timekeeping, increased tension and turnover. That's one of the biggest studies if you're looking at a mental health policy or strategy within your workforce that actually gives you the solid grounded-based evidence on mental health and how it actually goes from factors to actually things that you're seeing in employees. And again, it's bound in science, that systematic review. It's one done over the whole course of the NHS. It's a great study to look up if you're looking at anything for your business. Good practice and principles for mental health in the workplace. What we would advise is a holistic approach for mental health, that again, we're seeing not just the absence of disease, but the person as a whole, like that layered model I had explained to you, that it's a very layered, holistic approach to a person. We're not one-dimensional, and it's not just the absence of disease. That we plan, we monitor and evaluate any programs because we want statistics, we want to see what's going forward within the workplace. It's an ongoing and continuous process. There's no quick fix to this. It's constantly embedded in the calendar year. There's active involvement and participation from workers, so the whole thing of talent and engagement with the workplace, commitment and involvement from managers, communication, and again, intervention, kind of good mental health. What can employers do? It really comes down to having a policy, having something that's there in place for employees that they can go to. And again, there's a lot of documents I can advise you on with mental health first aid, as you had mentioned, mental health first aid training within the workplace. CIPD has done a huge study last year that was released on the role of the manager within the workplace, and it's now been kind of again bound in science that the occupation and the sector, so someone's role, the area that they're working in, combined with the organisation's culture, but also the management style, the role of the manager with health has been identified to health outcomes within the workplace. So it's not just someone getting sick, it's not just someone mismanaging themselves. There has been a lot of evidence that when you train managers, train team leaders in health and wellbeing practices and mental health practices, they can pick up on these signs and symptoms of employees. So there's a lot of studies emerging in this area that the role of the manager, the role of the team leader, the role of the supervisor has a dramatic impact in someone's actual health outcome. For workplace wellness to work, I mean, in the workplace, we see two nice buildings here. We see the skyscraper and we see the nice smaller size skyscraper with the add-on. It does some wellness programs. You can tick the box. You can do all these different things in a workplace and say you're doing this event and that event and this event. But really, it needs to be top down. You need to have the management, the CEO. It needs to be a top-down buy-in, and it needs to be embedded into the organization's culture from the top down. It can't just be a tick the box and an add-on, or my health insurer is doing X for me, or doing this or doing that. It doesn't work. It phases out. You're not measuring, or you're not kind of evaluating anything that you're doing. It has to be embedded from the top down and have support throughout the whole management structure of the company, dependent on the size. Some top tips, I suppose, from the last kind of 6-7 years of visiting companies, planning health and wellbeing programs, the role of the wellness champion, or the role of appointing someone with the wellness manager. And one of the biggest things is partnership and bringing people together. So if you have a sports and social committee, you have a, whatever it may be, a talent engagement team, you have whatever committees are set up, that you're bringing everyone together, and there's representatives from each area of the company, so you know what that company culture is. It's really important to to plan and develop a policy, to appoint wellness champions, meetings and needs assessment. Needs assessments are key to actually look at the need of what are you trying to do and solve. And again, evaluation and review is very, it's so important. A lot of companies will put in a wellness event and they've ticked the box and they've done it, and then they'll put on another wellness event and another wellness event. You're doing something, you're engaging people on site. That it is a good thing, but you can go a lot of steps further and actually track. I was at a company recently that has 5 locations in Ireland, and they have a health and wellbeing screening, and the person is going in and getting their health and wellbeing screening, and they're walking out with the sheet in their hand, and no statistics or figures are going back through the wellness team into HR. They're not monitoring it, they're not evaluating it. So when things come for budget or for whatever it may be within that organisation, or even to look at the impact of what over a long term, what health and wellbeing is doing in the organisation, they have no stats or anything to track it. Evaluation, monitoring things is really, really key, like in any plan, business plan or strategy. When you're conducting a needs assessment, again, it's a huge kind of thing to look at. But what stage is your company at currently? What are the needs that require the solution? So what area in wellbeing are you looking at? What are your aims? Are you looking at staff surveys, focus groups, whatever it may be, reviewing a current policy that may be in place? And again, you're kind of taking things towards the next step. So from implement a wellness program. You're looking at the need first of all. You're looking at what are you trying to solve? What's the issue? And the best way to do that is actually to do surveys with your staff, whatever stage you may be at. Engage your staff in SurveyMonkeys, Google Forms. Find out their culture. Find out, like I said in that exercise at the start, what health means to them. Know your own company, know your own culture, and then start planning your wellness strategy for 2019 or for whatever it may be, based on what's needed within your organization. That's what your need assessment is. Planning is really important. The timings of the year, always say to people, watch out for health promotion days. You'd mentioned Blue Monday there in January. There's heart days, cancer days. There's a lot of different days that mean a hell of a lot of, that there's a lot of media attention around. And you can also strategize and plan your wellness calendars to coincide with those. Implementation is huge because you want to actually implement it at the right time, at the right stage, and how you implement it and how you roll that out. And again, evaluation, it's probably one of the most important points. There's different types of evaluation. There's process evaluation, going through your whole plan. There's impact evaluation directly after you've done your intervention, and then there's your evaluation after 6 months, kind of looking back at it. There's a lot within that. And again, plan evaluation from the start. Write it into the actual wellness strategy and policy. Don't just do an intervention and go, how will I evaluate that with a survey, with a form, or whatever it may be. Have it kind of in your policy that you've kind of thought about this from the beginning of the intervention. Healthy Ireland, to give you some tips, again, you don't have to reinvent the wheel. There's an awful lot of stuff that's available to us. If you do look on the Healthy Ireland site, there's a Healthy Workplaces section that empowers you as a workplace to take control of health and well-being for your staff and employees. They look at every sort of a thing, like making every contact count, alcohol health in the workplace. They look at things with childhood, staff health and well-being, healthy eating, sexual health, well-being and mental health. And there's a lot of tools and a lot of resources on that you can actually read within 10 to 15 minutes, 20 minutes, print off your documents and form ideas for your own health and well-being strategy. It's a really, really good site, the Workplace Wellbeing site on that. Be smart about what you do. Again, make sure your aims and objectives are specific, measurable, achievable, relevant, and timely. Don't kind of have that's a really nice anagram to kind of follow. Don't have unrealistic goals. A lot of people will say, I'm going to do something on diet, I'm going to do something on physical activity, I'm going to do something on whatever it may be. Again, that's smart. It kind of keeps you, make sure things are measurable, that you can, whatever you're setting out to do, you can track it, you can record it, so you can always have these things to feed back into your business strategy or your well-being strategy. To go through WHO Healthy Workplace Model, this is something that's available free of charge on the WHO site, and it's a blueprint. It's your Bible for health and well-being within the workplace. Has anybody ever seen that document before? Never? Okay, so it's good I mentioned that, because it is an actual Bible for health and well-being from the top down for workplaces within Ireland. Actually outside of Ireland as well, but they particularly released an Irish version on the WHO site. It shows you how to tackle health and well-being within the workplace. It looks at the physical work environment. So the physical work environment was our health and safety acts, the way wellness and health and well-being used to be looked at within the workplace. Kind of health and safety acts, slips, trips, falls, accident policies. That's the way the physical work environment kind of was originally looked at. This also kind of adds on to the psychosocial, so our attitudes, values, beliefs in the workplace and how we incorporate those. Personal health resources, or all our engagement activities kind of on site, and then even going out into the community, and by empowering someone in the workplace, they empower their families, their partners, their local community, and by making every contact count, we're eventually changing society and the way people think. This is a model that kind of includes 4 pillars. It is actually quite easy to read, and it's one of the most simplistic blueprints I've probably seen on workplace wellness. And I suppose for you to leave today to give you a really good tool, that is a brilliant document to glance over if you want to look that up afterwards. Again, another one is the Sole Declaration of Safety and Health at Work. And again, it inserts kind of that healthy work environment as a fundamental right, and it gives an awful lot of statistics. If you're looking for buy-in from any top management, it gives a huge amount of facts and evidence towards why health and well-being, why we would do this, and the kind of return and investment that a business can get from it. I suppose to give you some, again, it's just these are kind of tools and ideas to get your head that you can start using straight away. Diabetes, again, is going to double in Ireland by 2030. Diabetes, again, it is one of those epidemics of non-communicable disease. It shares a lot of common risk factors: diet and physical activity, smoking, alcohol intake. Targeting those 4 risk factors in the workplace is huge. Diabetes Ireland, I don't know if a lot of you are aware of this, but for engagement activities, they have a free algorithm on their website that you can actually copy the link and send to all your employees by email. So if you're doing a health and wellbeing week, that diabetes screening tool is vital because it categorizes someone at what level of risk that they might be for diabetes type 2. So again, it's a free tool. It's a link that you're sending in an email, but it's quite beneficial to any health and wellbeing program, particularly if your budget or company, you don't have the biggest wellness budget. What I mentioned with workplace health and wellbeing programs, again, our own Healthy Ireland policy identifies the workplace as one of the key areas to empower health. And again, if you do go onto that Healthy Ireland site and look at workplace health and wellbeing programs, it gives you an awful lot of tools, initiatives, free things and documents and ideas that you can start off in your small business straight away to implement a policy, things that don't cost practically anything. Again, these are just some of the things that are listed on that site. Online lung checker, again, respiratory disease falls in at number 3 is the biggest cause of mortality in Ireland. And again, the Irish Cancer Society have a lung checker that's very similar to the diabetes one. There's an algorithm behind it and it can be sent as a link to any employee as part of any wellness program as well. It's just to make you aware of some of these different things. Particularly, alcohol is one of the huge modifiable risk factors of a lot of cancers, diabetes, cardiovascular disease, all these different things. Audit is another document that can be used. It actually has a risk assessment tool. So if you're doing something on alcohol, well-being, alcohol in the workplace, whatever it may be for the health and wellbeing program, that's, again, another blueprint for you straight to go to with your business that actually it basically does it for you. You can copy and paste the link and it goes straight to employees. Healthy meeting guidelines, another way to kind of bring health and wellbeing into your policy, into your own workplace for 2019. To health and wellbeing meeting guidelines, if you've come across those, they're all about walking meetings and kind of get healthy lunches. And instead of actually being on the phone, and guilty of it myself, there's conference phones and there's video conferencing within our work, and you're sitting down for the day, and sedentary lifestyles where we're sitting for kind of 6, 7, 8, 9 hours a day. The Irish Heart Foundation released just before Christmas the Chairs Can Kill campaign that even if we're physically active, the longer we're sitting, up to 6, 7 hours a day, it really slows down our metabolism and we're more likely to get a heart attack or stroke. So there's some great new emerging evidence. And again, there's some really good healthy meeting guidelines. If you haven't seen those, have a look at them. Ways to implement walking meetings, all those different things within our own kind of businesses. Again, making use of your marketing team are one of the biggest things I've come across from looking at health and wellbeing with organisations. Looking at things like just being inventive, keep fit, take the stairs Tuesday. Just if you have, I visit a lot of companies, particularly down the IFSC, and they're very, very tall and they have 13 stories high. And every day there's 6 lifts and someone goes in and they go up the lift and then they come down the lift at 5 o'clock. And it's little things like take the stairs Tuesday, utilise your marketing team, be inventive and be innovative and create different ideas, use what's there. And again, these things don't cost money to implement wellbeing in a 2019 policy. Last year, there was a No Elevators Day movement for companies, again, that are kind of highly built. And again, a lot of companies joined into this and actually supported this within Ireland as well. And again, they're doing the same thing for 2019. And one of the best documents is the NICE guidelines of 2015. If you look up NICE, it has a workplace management practices to improve health and well-being of employees. Again, very much like the WHO document, it's a strategy document that gets you going. If you've never looked at well-being within your own business, if you look at that document, it'll give you an actual strategy that you can adapt and change the wording around, and you won't be leaving any part of health and well-being out for your staff or employees. Some of the engagement activities that I've kind of come across over the last few years that actually engage and again kind of get people kind of motivated. Things like book clubs, Barber Day for men in companies, to give you some ideas for 2019, linking in with health promotion days. non-alcohol party, summer barbecues, recipe swaps, walking clubs. There's a lot of different, it's about really, well-being really, it comes into everything. That holistic diagram again comes into where we live, work, grow, love. There's a lot of, it's a very holistic, to get you trying to think that health and well-being, it's very, very layered, it's very, very holistic. And there's a lot of engagement activities that you mightn't necessarily think are diet, alcohol and physical activity related, but that engage people and attract, it's fun, it's improved mental health, self-esteem. There's an awful lot of these things that really, really do work within companies. Two main rules, I suppose, kind of going to go back to health in all policies. What are we trying to do in the workplace? Well, actually, in every single policy that we have, if we can try and incorporate health into it in some way, shape or form, that's a goal where it would be amazing to achieve. And the other thing that we're trying to do, create a supportive environment for employees, is to try and make the healthier choice the easier choice. And again, I've seen this in companies that offer the Red Bull and all the nice snacks and the sugary snacks. They're now starting to frost over their fridges, and they're trying to kind of hide the badder things and make the healthier options and fruit more accessible and easier. If something's in front of someone, they're going to reach for it straight away. Whereas if there's policy in place to try and, try and stop people reaching for the high sugar option straight away, there's a lot of companies trying to follow these two rules. If you're to take something away from today, in your policies, in your strategies, try and implement health in some way, whether it's transportation for staff, getting to work, whether it's diet nutrition, whether it's physical activity, whatever it may be. Try and think health in all policies in your business. And the other thing I'd say to you is try in your own workplace to try and make the health, how can I as a business provider make the healthier choice the easier choice for my employees? And again, there are two questions I would say to ask yourself. Can anybody tell me what they see in that picture?
Somebody's going under.
Someone's drowning, someone's going under, absolutely. Someone is drowning in that picture. And again, I really like this analogy because I think it's a nice way to look at health and well-being. Where we need to be going within the workplace is what we see is someone's drowning. So what do? We kind of run in, we save them. Next thing we see someone else coming downstream. They're drowning, we run in, save them, call 999, whatever it may be. Next thing we see another person coming downstream. My point is we need to be asking ourselves, we cannot spend all our resources when someone is downstream. We need to actually jump upstream and actually ask ourselves the question, why is the person falling in? And that's what prevention is. We need to be upstream policy, upstream initiatives, upstream strategies before people start to get sick. We can empower people. And I'm going to do an exercise on that just to finish up in a minute or two. The future of health, of workplace wellness, where are we going? We're actually seeing an awful lot of health and wellbeing programs focusing on particularly parenting seminars, the first 5 years of life. Within health, the first 5 years of life kind of lay down the foundations for what's going to happen to us as we progress across the life course. Sir Michael Marmot in the UK is a guru in, he advised the World Health Organization on the determinants, things that affect our health. And he wrote the Bible on what's happening in health at the minute. And he's identified the first 5 years of life as a crucial time of habits, of behaviours, of how we'll turn out later on in life. And he's a huge amount of evidence on that. So within the workplace, we're seeing an awful lot of early intervention from prenatal, kind of this kind of postnatal, this kind of womb to tomb approach with well-being. We're going to see a lot of programs, obviously, across the lifespan. It's small everyday changes, it's things on diet, physical activity, all those modifiable risk factors that are causing disease. That's what we're seeing across the lifespan. And then as we enter the silver circle into retirement, well-being is incorporated with benefits and pensions and financial well-being. So we're seeing an awful lot of that. Some of the initiatives just that we do at DeCare, we do an awful lot of health promotion days. There's a health article every quarter within the SFA magazine that tries to inspire businesses about health and well-being if you haven't seen it already, just to keep an eye out for that. Our own company, we do a full program of health and wellbeing training with managers and team leaders. We have health and wellbeing training available. And again, this is a full program that covers physical, social, mental health and wellbeing. We do offer wellness programs. Being a dental company, every wellness program has an aspect of oral health in it. So the mouth is the gateway to the body. So we have the first health screening with full dental check within Ireland. We offer parenting seminars, smoking cessation programs, blood pressure checks, diet nutrition programs, and just a little bit about our company too. We also train in the healthcare sector as well. Lastly, just to finish up on the, I hope some of those ideas have inspired you to kind of think about health and well-being for your organisation for 2019, and kind of have a view of, there is 4 modifiable risk factors that we are trying to work on that kind of ultimately cause disease within Ireland and globally. But I want to just do a quick behavioural change exercise with you. I left this to the last just to explain behavioural change, what it is in the workplace. We ultimately strive for behavioural change in every aspect of health. We want people to actually, the healthier choice to be the easier choice. We want to change behaviours. Changing behaviours is quite complex and it's quite hard, but I want to show you how you as a business and how you as a workplace can do that, and actually be a leader in behavioural change in the workplace. So there's a few different models that are available from the theory of reasons actions, social cognitive theory, lots of health belief model. There's a lot of these, and some of these actually come into business as well. But the one I want to just focus on, just to finish up, is the behavioural change model. This actually comes into a lot of, not just health, but it actually comes into business as well. And this is why I've chose it today. So what I'd ask you, just to finish up today, if you look at the yellow post-it that you kindly got as a gift when you came on your folder, if you're wondering what it was for, what I would like you to do with your yellow post-it is to actually write an intervention or an initiative, because it's 2019 and it's January, that you are thinking about in your own life. So it might be something on diet, physical activity, might be better sleep, might be actually socializing more or socializing less, or something within your own life that you'd like to change. And have a think about it. It can be a word, it can be 2 words, but where you just to jot it down on the post-it, something that you're thinking about for 2019 that you'd like to change about you or yourself. So what I want to actually explain to you, just while that's on, if you can see the screens or you can see it here, I just want to explain, it's using a business model and a health model, and it's just the stages. It's a psychology model of the way we think of change. And the way I just want to explain it to you very, very briefly is that we're the pre-contemplation stage. I want you to think of something, I asked you to think of an initiative. What pre-contemplation is I'm thinking about this, but I haven't done anything myself. So I'm still thinking about what I've asked you to write. Just think about this. I'm still thinking about this, but I haven't done anything, or haven't done anything in my life to start this change process. Contemplation is contemplating. You're contemplating it. You're making the first steps to thinking about that change. Preparation is you're preparing for it. You've maybe done research. You're kind of looked up a gym, if it's a physical activity thing or whatever it may be. You're preparing for it. Action is what I've asked you to think of. I've asked you to think of something that you want to change for 2019. Action is you're doing it straight away. So you might have wrote that, whatever you wrote on that page, you might have said from January 1st, I cut out alcohol for the month of January. So that's action. You're actually actioning it already. Maintenance, again, it's maybe you've started physical activity was your thing, and maybe you've started it again from January 1st and you're already on day, 7 or 8, and you're actually running 7 or 8 days in a row. So you've kind of actioned it already. And then the last part we won't worry about, the relapse part, but what I want to invite you to do is to actually come up with your post-it and to put it on which area of the circle you would see where you are at right now with that, if that makes sense. Well, that's brilliant. Thanks for that. Believe it or not, we have 1, 2, 3, 4, 5, 6, 7. Believe it or not, we spend 60% of our lives contemplating what we'll do, and we never actually do it. So a lot of us spend 60% of our lives thinking about what we'll do, but we never put an action to it. So I'm going to use this workplace example. So someone says, reconnect with my friends, being a social aspect of health. Someone said, reduce my sugar intake. Someone said, cut down on sugar and diet. So I'm just going to use those as an example. In a workplace, if we asked our staff a survey and asked them what are they interested in for health and well-being, or what does health mean to them, or what would they like to look at it for 2019, and we got some of these things back, what do you think we can do? There's a thing that we call a nudge. As a workplace, we can be a supportive environment, and by having initiatives on site, by having policies, for example, for these sort of things, what could we do? Well, Reduce my sugar intake would be a diet initiative. You could have people on site within a workplace that if someone is thinking this in their head, that would make the healthier choice the easier choice for them to actually action that. So what we're actually doing with that one is we're nudging the person from contemplation into preparation. So you can actually, believe it or not, do behavioural change within the workplace and empower people to make the healthier choice the easier choice by having a health and wellbeing policy, by having structures in place. It won't work with everybody, but it will make the healthier choice the easier choice and empower people that they can make it, that it is an easier option to go for. Contemplation, again, reduce my sugar intake. I just want to see one or two of the preparation ones. To work a little bit more. Again, walking groups, 5K at lunch, all these different things, initiatives that you're seeing starting up. To take 1 hour of my day to exercise rather than to leave it until tonight. People are in preparation for these things, so you've actually made the choice to start preparing for something you're going to do. Great ideas, but again, how can the workplace impact on those? By creating a supportive environment, by actually having physical activity people on site, by utilising, knowing your culture, knowing what your people are thinking is vital to your wellness policy and creating a positive kind of a supportive environment. But the second thing I'd always say to you is, this thing is called a nudge. You can nudge people from contemplation, from something they're thinking of doing to actually doing it, because you have the power in the workplace. To lead to my last slide, workplaces have the power to change lives, and that's really true. We as a workplace, through creating a supportive environment for employees, can action some of these things and ultimately start changing people's lives and actioning their thoughts and putting them from contemplation into a reality. Does that make sense to you? Does that? Yeah. Again, what I'd say to you, if there is any, I'd like to thank Sven and the SFA for their time today. I know it's a brief intervention slot where I cannot talk about every single aspect of health, but I hope there's some key principles that you've taken away from today, including the way that we don't think about health as disease anymore. It's a very layered, holistic approach, policies, implementing evaluation, and there's lots of different things out there that are available for free that we can start implementing that can get our heads, get us kind of innovated for 2019 for health and wellbeing.